Welcome everyone to today's the third of the pre-proposal conferences for the Tri-County RFPQ. You'll be joining us today with Clackamas County, Multnomah County, and Washington County for this joint event for the Supportive Housing Services Program, which is a regionally funded program to address homelessness and housing instability and prioritizing communities of color. I'm going to do currently, I did just see a chat asking if you're on mute. Currently, you are on mute, but as we go throughout the meeting, we are going to encourage folks to participate. And that's actually a great question to have me transition into just a little housekeeping for today. So for today's meeting, we will start everyone off in the mute option, but we will be allowing and giving folks space and opportunity to unmute yourself throughout the meeting to ask questions. Participants are encouraged to if you see the 3-dot option on the top of your little Zoom picture, you can go ahead and change your name there. We also would like to invite our guests to participate in 2 ways. One is using the chat feature, which I think some of you have already figured out. So you can go ahead and participate there with your questions or comments, or even sharing information. And then secondly, there's a question and answer option. If you go to the bottom of your screen, you will see a small box that says Q&A. You can click on that, and there's where you can have a chance to answer or ask questions. And our esteemed colleagues from the different regions will, throughout the meeting, be answering your questions. So that's another great feature. You can go and check on the answers, and maybe your question gets answered there in that section. But like I said before, this is a participatory meeting. So if you do have questions that you might like to feature in the chat, go ahead and do that. And then the final option is really just raise your hand. If you hear something today that you'd like to get clarity on, go ahead and raise your hand, and I'll do my best, and my colleagues will also be monitoring the participants and any questions and raised hands that might be raised. We'll try to respond to you as quickly as we can. In our previous meetings, we did offer translation. We had a Spanish translation at our previous meeting. We did not receive any requests for translation today for today's meeting, so that's not going to be offered today. But again, in our future joint events, that is always something that we would like to prioritize. All right, and then I'm going to quickly go over today's meeting agenda. Today, we'll have some introductions in just a minute from our 3 leads from Washington County, Multnomah County, and Clackamas County introducing their teams. We'll be hearing from the Tri-County RFPQ priorities from each of the counties, speaking to the SHS measure and also the diverse range of providers they're seeking, as well as the local vision for each county. Preceding the Tri-County racial equity priorities will be presented by Neva Bennett. We will hear more about what does it mean to be a qualified vendor today. We'll go in depth about the service delivery. This is a key thing that we want to spend a little extra time on. So there's a lot of clarity on the delivery and the service components that are featured in today's RFPQ. We will also walk you through the RFPQ's Procure Now OpenGov website and just some of the features of that website and how to use it and make sure that it's accessible to all. And then finally, we'll have time for questions and answers at the end. We'll give a little extra time to that. But throughout the meeting, again, we want to encourage this to be a participatory meeting. And so we're really excited and glad to have you all here. Now at this time, I'd like to go to the next slide. We will start with some introductions. And I want to just check to see that we have all of our leads here today. So we'll do some quick introductions of our Washington County staff that are here. So Washington County, you'll be hearing from several of our colleagues, and some of them may not be present today, but we'll be hearing from at least Jess Larson, the Supportive Housing Services Program Manager. Jess is here, so I will turn it over to Jess, who I just need to promote as a panelist. There we go. All right, so let me turn it over to Jess to introduce the Washington County team. Thank you.
Oh, thank you, Ty. Hi, everyone. Good to see you all. Excited for this meeting with you. As Ty said, I'm Jess Larson, Supportive Housing Services Program, and thrilled to be here with the Washington County team and our partners in Clackamas and Multnomah County, making this first ever tri-county procurement process possible. So big thanks and shout out to Ty, who's our community engagement coordinator for the SHS team and is our fantastic facilitator for this meeting today. Alex may also be joining us. If and when you begin contracting with the SHS team in Washington County, he's someone you get to know very well, very quickly, because he leads a lot of our contracting work with our service providers. And then, of course, you'll be hearing from Susie Fulcher later, our fantastic purchasing supervisor, who's been the technical expert making this tri-county procurement work possible for us in Washington County. So thrilled to be with you. Ever grateful for this amazing team and many, many more colleagues behind the scenes helping to lift off this great SHS work. And with that, I think I get to pass it over to my colleague, Josh, who will be doing the same for Multnomah County.
Good afternoon, everyone, and thank you for joining us. Yes, my name is Joshua Bates. I'm the Deputy Director at the Joint Office of Homeless Services. And I'm joined here today with my colleagues from Multnomah County. Specifically, we have Adam Brown, who's our Business Services Manager. He's really going to be supporting the, explaining all of the different contracting dynamics when it comes to working with Multnomah County. And then we have Crystal Otero, who's really been leading on our side this tri-county alignment in this process. And then finally, we have Neva Bennett, who is our Equity Engagement Coordinator, who has really coordinated and transformed the procurement, the tri-county procurement, to center the needs of our culturally specific organizations and our smaller organizations. So yeah, there are all of, I guess Adam Brown will not be here today. Sorry, I didn't have the slide in front of me. But yes, Adam Brown is the person internally who's supporting, he's our Business Services Manager. So with that, I will turn it over to my colleagues at Clackamas County. I believe Vahid will be facilitating.
Vahid is out, but I'm here. So I'm Abby Ahern. I work for Clackamas County Supportive Housing Services team. I focus on data and policy for the team. We have a small but mighty team. So this is pretty much most of it on paper right here. And so we all do a lot of things. Vahid Brown is our manager, our Supportive Housing Services manager. Jamie Stark leads the contract and procurement work and some of the finance work with the agencies. And then Cody is our analyst extraordinaire who props us all up with all the planning and coordination.
Great. Thank you so much for that. Now we're going to move on to speak a little bit about this measure and who should apply.
I'll be taking this section. My name's Crystal Otero. I'm with Multnomah County, and I use she and her gender pronouns. So who should apply to this RFPQ? In essence, everyone at this pre-proposal conference should strongly consider applying. We are across the 3 counties. We are hoping to expand provider capacity to help us implement the goals of the supportive housing services measure. In particular, organizations that grew during the COVID-19 pandemic to address many of the community needs that became very apparent as that pandemic really started to affect our community. Those organizations helped to informally provide homeless services in our region, and we want to extend a special invitation, an invite to those organizations. So in this chart, I'm going to break down some of the basic questions we've received over the last month about the technical differences between the 3 counties. So many organizations actually hold contracts in Multnomah, Clackamas, or Washington counties. Those contracts currently do not extend to the other 2 counties. That's one of the primary reasons we're doing this regional procurement. So if you look at the chart here, if you have a contract in Washington County and you are currently qualified to provide supportive housing services, you do not need to apply to this RFPQ unless your organization wants to meet qualification for other service components than those you are currently qualified for. So in this RFPQ, both the Washington County Supportive Housing Services RFPQ and this new Tri-County RFPQ, the service components are the same. There are 5 service components. If your org applied for 3, but you want to apply for the other 2, you'll want to submit a new application to this Tri-County RFPQ. If you are currently contracted for homeless services in Clackamas County and your org wants to be in a qualified pool of vendors that is eligible to contract with Multnomah and Washington counties, you want to apply to this RFPQ. One thing to note about Clackamas County is that this is the first time they're doing an RFPQ process, which means that if you are qualified, you are a qualified vendor for 5 years, and you will receive opportunities for contracts over the course of those 5 years. Previously, in Clackamas County, you were awarded a contract for each contract opportunity. So this is going to be a very different procedure. And if you have questions, you'll want to direct those in the question section of the RFPQ on the Washington County portal. Finally, in Multnomah County, if you hold a contract in Multnomah County for homeless services and your organization wants to be a qualified vendor to the other 2 counties for the next 5 years, you'll want to apply to this RFPQ. In addition, something about Multnomah County is that for homeless services, contracts are population specific. So we have an adult system, a youth system, family system, and domestic violence system. So some organizations just hold contracts, for example, in the youth and family system. If that's the case for your organization and you want to provide services to the adult population or the domestic violence system, you will want to consider applying to this RFPQ. Now, this is a tri-county RFPQ, so all qualified vendors are eligible to contract with the 3 counties, Multnomah, Clackamas, and Washington County, for the next 5 years for each service component that you apply and are qualified to deliver. I hope that clears up any questions that you may have around the differences in the 3 counties.
Great.
I'm gonna-
I'll I'll take this slide. So the supportive housing services measure, a little bit of background for everyone to just step back and give kind of the overview. The regional supportive housing services measure was drafted by a broad coalition of culturally specific organizations, community service providers, business leaders, housing advocates, and elected officials who work together to address the growing crisis of homelessness in the region. The measure was created to leverage investments for the 2018 Regional Affordable Housing Bond, along with other local investments and initiatives. On May 19, 2020, the measure 210 passed with 58% of voters and established a regional supportive housing services program. The SHS program will be funded with a new income tax on high earning households and business profit tax, together estimated to generate more than $200 million annually for 10 years. The fund will be distributed by Metro to 3 counties within the Metro boundary, proportionately by the estimated revenue collection as follows. So Washington County, 33.3%, Multnomah County, 45.3%, and Clackamas County, 21.3%. The 3 counties will each develop an enhanced local homeless and housing system of care while working together to address homelessness across the region. The SHS program will be the largest per capita investment in the nation dedicated to ending homelessness with supportive housing services. All right, I'll turn it back over to you, Crystal.
Sorry, Crystal, you're muted.
Cool. It's probably the universe letting me start again. So I want to briefly cover the priority populations. And Ty mentioned that there was a measure that passed in 2010. So that measure stipulates that 75% of the supportive housing services funds need to be dedicated to people that have a disability, that make 0 to 30% area median income, are literally or chronically homeless. 25% of funds can need to go to what's considered population B. Those are folks that make 0 to 50% area median income and are either literally homeless or at risk of becoming homeless. So in addition to that, there's a priority to end racial disparities across the region within our homeless service outcomes. So one of the main priorities or priority populations are people that are Black or African American, or I should say Black and African American, Indigenous, Latino or Latina or Latinx, Asian, Pacific Islanders, and immigrants and refugees. So in particular, the 3 counties are looking to expand culturally specific services that address, we want to expand those services and also bring in new services. So we want to address the gap, the service gap that currently exists. So those are the priority populations for this measure. I'm going to hand it back to Ty now.
Great. And I did see one question on population A from Andrea Meyer. The RFPQ says, disabling conditions, do mental health and behavioral health challenges count? And I see
Yeah, those disabilities do count. And I want to note that because this funding stream, the supportive housing services funding stream, is a local funding stream, we've been able to reduce some of the barriers around the distinction of having a disability. So as we understand it right now, this is how how do I want to describe this? It's up to the client that we're serving. They can self-certify that they have a disability. So this does not require a third party or like a clinical verification that that person has a disability.
Great, thank you so much. Now, I'd like to turn it, actually, hold on. So before we go there, I was going to turn it over to the leaders of each county. So I'll have you on deck. I'll invite Joshua, Jess, and Abby here to join us for the next slide here shortly. But first, we wanted to, again, go over some of the range of service providers that will be qualifying for this RFPQ. So we have culturally specific organizations, culturally community-based service providers, affordable housing owners and operators, outreach organizations, and this is outreach organizations. This is a pretty broad term, but I know that this can encompass many smaller organizations that might be culturally specific, that do already have outreach efforts going on within their organization. So, so this one might speak to some of those groups. Shelter and transitional housing providers. Oh, great question. I see. What is the definition of a community-based organization? I might reach out to one of my colleagues to see if there's more information on that, and maybe you can come back to that question. Does anyone want to address the definition for community-based organizations?
Yeah, I can hop in, Ty. It's a great question. I don't know if we have a specific like technical definition, but in essence, it's like a local nonprofit or even a for-profit agency that is providing community-based services. So community-based means services that are specifically for people that live in the Tri-County region. And the services can be a broad range, right? Just actually what Ty is describing here. And there's no like certification required or any specific type of organization. So it's just in essence, local agencies that are providing services.
I think another way we can think of it too is these are non-governmental organizations.
Well, thank you both, and keep the questions coming because we love the interactivity of these meetings. It keeps us on our toes. So thank you for these wonderful questions. Also, where did I leave off? So behavioral health and community health providers. I think this is an area we want to continue to look at ways we can integrate the healthcare system and the housing services. So this is incredible, I think, connection. Providers of wraparound services and supports. We're going to be talking a lot more about that wraparound services in our service components section. So we'll go deeper on that. And then of course, faith-based organizations. And this is to all faith-based organizations. I think we know that faith-based organizations have traditionally been the home for many of the house of services over the years in our region. And so I think that's continuing to lift up those great leadership in those communities. And before I get ahead of myself, I think we're wanting to invite our local leaders from each county now with this slide. So I'd like to ask Jess maybe to kick us off, and then if you could hand it over to Josh, and then Josh over to Abby, that'd be great. So turn it over to you all.
Thanks, Ty. All right, so this is just a moment to hear a little bit from us directly about what's happening I think right now in our SHS programmatic work and how we're planning to expand in the near term. Though, as we describe these things, don't worry if there are other services and programs that you want to provide in Washington County. We'll be growing for a while, and I might not get to all of this in this brief sort of status report. So far with our SHS funding, we have launched, I think, three major programs. We've launched some bridge shelter programming. These are housing-focused non-congregate shelters that are especially designed to serve higher needs households with all the wraparound supports to help them connect to housing placements in some of our project turnkey and temporary sort of motels that we're currently operating temporarily as shelter. So bridge shelter programs, winter shelter programs, both non-congregate and congregate, with time limited, because unfortunately we don't have permanently located shelter capacity yet. We're working on that next. But we have launched some winter shelter programs this year. And then our biggest kind of foundational program that we launched with SHS so far is housing case management programs. And this is a program designed to specifically serve population A households with long permanent wraparound supports through a case manager and all of the services they will connect their participants to, plus the ARLA voucher, the long-term rent assistance voucher program that we're all launching collectively in the region. So that's where we're at so far. And looking immediately to Q3 and Q4, we've got some really exciting programmatic growth ahead with launching some new PSH site-specific permanent supportive housing placements. We have a LOA Inn, which is going to be opening as a 54-unit permanent supportive housing program. We also are actively seeking permanent shelter sites. So we will be actively seeking permanent shelter program operators for those sites. We are also launching some pilot programs around sort of basic needs stipend to support people living with disabling conditions who have not yet qualified for disability benefits and are living with zero income in some of our PSH programs. So we want to provide them with basic needs a stipend that will be paired with some of our programming. We're also embedding housing system navigators in some of our other systems of care. So those are some smaller pilot programs. And then sort of the next big foundation in programmatic growth is the expansion of immediate or short-term housing assistance and medium-term housing assistance. We're calling these programs, well, you've heard of rapid rehousing. So we'll launch a sort of SHS rapid rehousing program, and then also a rapid resolution, like a one-time rent assistance or housing intervention to prevent homelessness from happening in the first place. Some population B focused rent assistance and case manager services. So those are the program specifics, but in general, we're also hoping that this RFPQ in partnership with our counties brings into our network in Washington County an expansion of culturally specific service providers to help us do this work, and also affordable housing owner and operators to help us build out that system of PSH capacity in their buildings. So a little bit of where we're at and what we're looking for with this programmatic expansion. You're up next, Josh.
Thank you, Jess, for that wonderful kickoff. So at the beginning of Jess's part, she uplifted that growth is really core to this SHS program. I think whether it's Multnomah County, Clackamas County, or Washington County, growth is really the operative word. We're growing vastly. And I think that this RFPQ is really about vastly expanding the providers that are qualified and are ultimately funded to provide services across all three counties. In Multnomah County, we really are focusing on this value that was in the SHS measure, which is lifting up experience and lifting up local experience and leading with the expertise of our community. As Crystal said, every organization that is present here today should really apply. The program, the SHS measure in the program is about meeting organizations and meeting our community and meeting individuals where they are at and expanding our provider pool to really meet the need that we are seeing in our community and that each of you are seeing in our community. Many of you are already doing this work, you know, whether that be in churches, whether that be in community centers, whether that be just individually out of the places that you live. And we are really trying to center that uniqueness and meet y'all where you're at and provide funding and support and capacity building to where you are at. So as was uplifted earlier in this presentation, really in Multnomah County, we're focusing on that expansion, but also a couple of areas, right? Culturally specific and culturally responsive organizations that provide affordable housing, behavioral health and outreach, shelter and transitional housing, really the complete array of different types of services. We're trying to just expand the qualified vendor pool, help build the capacity of organizations, and ultimately support the work that you are already doing. So as I said, really the purpose, I think that right now, our focus in Multnomah County is meeting organizations and meeting our community where they are at, and expanding and supporting the expansion of organizations that are providing services in Multnomah County. So with that, I will now pass it over to Abby. Go for it, Abby.
All right. Well, thank you all for being here and for having interest in this really exciting work. I like following Joshua. That was good energy, very excited energy. So I'll try to keep it up. So Clackamas County, we are a small but mighty team. We are gradually expanding. I think we have 5 or 6 folks on our team right now, and we are working at beyond high capacity to make things move here. So in Clackamas County so far, we're contracted with 6 organizations. Those contracts were signed as early as mid-October. And in that work, we, with those 6 contracts, we have 2 culturally specific organizations that are new to working in Clackamas County. And so that's very exciting. That's really meeting some of our initial goals and hopes for this program. Those programs, those 6 organizations are focused on a couple different program areas. One is navigation. So we're essentially piloting a navigation specific program to move folks from COVID-funded hotel motel shelters into permanent housing. We worked really hard to get our very most vulnerable folks into shelter to avoid any chance of, or to avoid chances of contracting COVID, and now we have to move those folks into permanent housing. So we're very focused on that effort. And then the other part of it is once they're in housing, we need to provide supportive housing case management, or permanent supportive housing, or PSH, as folks might know it. And so we'll be doing that with those folks and for some other folks in our community who are in need of that supportive housing case management. We also have a transitional housing program we're funding that works to connect folks leaving jail or prison to long-term housing options. And then obviously our ARLA, regional long-term rent assistance, which is connected to our supportive housing case management program. We have 30 households on ARLA so far, so we're really excited about that. That's been a lot of work to get there, and we expect that to continue to pick up quite a bit month by month as we move forward, as our programs are established and sending in applications and actively searching for units. So we're really excited about that because it's hard to get that program moving. We have a very strong ARLA team. Just another small but mighty group. There's 3 or 4 of them on that team, but they are making it happen. We have one thing I'm really proud about is how housing first our ARLA team is. They are really, our rent assistance folks aren't always in that total realm of housing first, but they are really bought in. Some things we want to continue to invest in program investments and system-wide priorities. Some program investments are continuing to build connections to community-based organizations, specifically those that are culturally specific and new to Clackamas County, through technical assistance, training, infrastructure development, and direct funding. We're going to increase emergency shelter capacity to provide immediate shelter in the form of congregate, non-congregate, transitional, facility-based, a mix of those things. We're in the process now of doing a little more deep dive into the data to see what's needed. We're going to expand wraparound supportive services like everyone else has been talking about, case management, mental health, peers, drug and alcohol support, addiction support. Expand housing placement services. Obviously, that's the goal here. We got to end homelessness and folks have to move into housing. We're going to increase all types of outreach, street outreach, in-reach, all the reaches. We'll invest in eviction prevention efforts as well. And then system-wide, we're going to obviously continuously evaluate our program and develop and our development and our performance. We want to do the most with this funding and make sure none of it goes to waste. We'll be enhancing data collection and sharing capabilities so that we can better coordinate across our 3 counties data-wise. And then we'll improve our system navigation and coordinated access system. So the way folks get into our programs and the way they access our services. And then we'll also continue to expand our internal capacity to keep hiring folks on our team so we can support this great work. That's all for me.
Thank you so much, Abby and Jess and Josh for great presentations there on local visions. So now at this time, I'd like to introduce Sunniva Bennett, Equity Engagement Coordinator at Multnomah County.
Hi, everyone. Thanks for being with us today. I will summarize a bit of the racial equity priorities for this Tri-County RFPQ. As it's already been mentioned, a goal is to expand our culturally specific provider network. And to one of the questions in our chat, that does include the LGBTQIA community and also communities of color, refugee, immigrant communities. That is a goal of the SHS measure is racial equity in general, and ways that we're achieving that is through expanding this provider network. And part of that is understanding the needs of the community, understanding how homelessness disproportionately affects communities of color, intersectional communities, LGBTQI communities. So with that in mind, we have also included specific language that expands on what we mean by racial equity. And that language is around an anti-racist service delivery approach. And we define that in our RFPQ as services that address and name racism as a root cause of inequities impacting lives of people of color, immigrants, refugees, and acting from this knowledge while furthering the effort to address racism through racially equitable programs and policies. So we want to be sure that we have participation from a wide variety of organizations and organizations that are doing grassroots work. So we have also included for what will be the first time in a lot of procurements. So something that's new is technical writing assistance. And with that, you would work with a consultant to articulate your the services and that you'd like to apply for in the application. And that is from feedback from our community members. And we ask that you apply for that. We are on a short timeline. Apply for that by the 14th, which is this Friday. And we have the form linked in the portal, and you can also email me. And I think that that is what I have for us about that. Yeah. The portal is open, let's see, it's Washington County's Open Gov. Do we have a link for that portal that we can put in the, I just saw a question in the chat.
Yeah, we will show, oh, there we go. Somebody dropped
Great.
that link, so thanks so much for doing that.
Thank you.
All right, well, thank you so much, Neva. I will be moving on now to briefly discuss what it means to be a qualified vendor. So all proposals in this response to this RFPQ will be evaluated by the Tri-Counties committee based on the criteria listed. And we're going to go a little bit more into that here shortly. But before that, we just wanted to make sure we're explaining to folks what it means to be a qualified vendor. Essentially, you become one of the selected suppliers. You'll be added to the Tri-County SHS supplier pool, and from which contracts will be awarded through a separate allocation process that is basically based on each county's priorities. The counties reserve the right to qualify additional suppliers for procurement services as they deem necessary. And there's no limit to the number of suppliers. So I think many of you have been through RFP processes. This is an RFPQ. It means we're qualifying you. So it's not as a competitive. We don't have a limit to the number of qualified suppliers. So I think that's an important thing to note. And again, this is a open RFPQ that will extend for likely around 5 years, but our counties are going to be reserving the right to reopen this RFPQ in the future. So this RFPQ process will qualify you through March of 2027. That's a great timeline and gives you 5 years to be a qualified supplier. Another piece of this to highlight, and I think each of the leaders from each county kind of highlighted this earlier in their presentations, but that some of the selection criteria will be including the SHS local implementation plans and strategic priorities. Since this allocation process is considering a variety of factors, funding may go to suppliers who did not earn the highest overall RFPQ scores, but it will be possible to qualify under the RFPQ process and not receive a funding allocation due to resources, limitations, and other factors. There is no guarantee of any contracts or funding will be offered to any qualified supplier. Great. So I'm going to pause there and see if there's any questions specific to that slide, or if there's anything I can do to clarify any of that. Otherwise, I'll move on to the next slide. Okay, so this is a question. We do see a question for Desiree. If Multnomah County, anyone from Multnomah County would like to respond to that question now, or we can respond to it later.
I can hop in real quick, Ty. This is Crystal from Multnomah County. I responded in the chat, but in essence, to Desiree's question. No, you do not need to apply to continue your current contracts with Multnomah County.
All right, so let's move on to the service delivery. I'd like to invite Crystal Otero, our administrative analyst from Multnomah County, to kick us off, and then I'll back you up here in this portion of the presentation. So thank you.
Thanks, Ty. So we want to just quickly cover our service delivery values, and I'll also invite Abby Ahern to share any additions from Clackamas County. So these are the service delivery values that are going to extend across the 3 counties, and we want organizations that have a foundation of racial equity, that are culturally specific and or culturally responsive. And these are things we indicated earlier. These are the values that we are seeking to promote through this RFPQ. The housing first model, low barrier, and low barrier means services that do not require like a lot of documentation or medical referrals. These are services that somebody off the street can start to receive almost immediately. And evidence-based practices, including harm reduction and trauma-informed practices. And across the 3 counties, there are varying levels, but some level of training available around some of these evidence-based practices. And these practices are infused throughout the region and expressed in different organizations, as well as the approach by each county. Ty or Abby, did you want to add anything here?
I mean, we have like a very large list of our values, and they go into a lot of details and explain a lot of this stuff. One that I don't see here is sort of the person-centered, progressive / assertive engagement sort of approach that's baked into a lot of these concepts, but not explicitly stated on this slide. But we're really trying to take a history of best practices in this work that you all have been doing, and we all have been doing for quite a long time now, and make sure that the best practices come through to supportive housing services, and the ones that aren't best we leave behind. So that's what we're trying to do here. So all the ones that work, we're bringing forward. These are really good.
And I'll just add, at least in Multnomah County, if organizations are not familiar with the assertive engagement model, this is a training that our county offers to all social service providers. And so if you are qualified through this RFPQ, you'll have an opportunity to attend an assertive engagement training. I think we can move on to the next slide. Did I glitch out? Okay, I'm seeing movement. Oh, we're on the next slide. Okay, I glitched out, not the technology. That makes sense. Neva, I don't know if you're available. There is a question in the chat, and I think we could briefly talk about that now. It's from Sandra. What elements do you require to ensure community or culturally responsiveness beyond staffing, leadership, and community identities? And I think this is actually a question for all 3 counties. In Multnomah County, these ideals are expressed in our contracts. So we have a requirement that all of our contracted services meet a baseline of cultural responsiveness. We have that defined in our contracts. In addition, we require all of our contracted providers to create an equity plan as a part of their contracting obligation. So those are 2 examples of how we are holding providers to this value.
Yeah, thanks, Crystal. Yeah, I think that sums it up well.
And similar for us in Washington County, cultural responsiveness is something that's required of all partners and different than being a culturally specific organization. And I see Abby from Clackamas nodding along. So that's consistent across the Tri-County partners, and that will be sort of demonstrated through contract requirements, reporting, training, support through our programs, etc.
Yeah, I'll just add a tiny bit on that, which is not only do we require that all organizations are culturally responsive, but we require that we be culturally responsive as admin teams leading this work. And so it's baked in at all of the levels. And so we are making sure that we make it as easy as possible for you all to be culturally responsive with, like Jess said, trainings, support, technical assistance, data analysis, and a continued commitment.
Okay, I want to move into this next section about service components. And I think there's a couple of questions in the chat that we didn't address. And so, Ty, can you capture those? And I think we could return to those questions when we have our Q&A section. So now we're going to go over the SHS service components. And for providers on this call or in this meeting, if you have downloaded the RFPQ from the Washington County portal, this is a good time to pull that up. And if you have it up in front of you, you'll want to look at section 4B. This is on the SHS scope of work. And this section covers the different SHS service components. So over the next several slides, I'll be reviewing the components, but in the RFPQ, there's a broader description, really detailing many of the services that we're seeking there. But this is not this list, it's not comprehensive in that it's not just the things expressed in this list. And there may be some services that will be under this category as time goes on that aren't articulated here. So these are broad categories that you'll want to consider applying for. And I'm also going to invite Ty and Abby to add any additions here because to represent each county. So in total, there are 5 service components. There's outreach and engagement, shelter and transitional housing, connections to stable housing, supportive housing stabilization services, and wraparound supports. So we'll now go into each component. So on this first slide, this is talking about outreach and engagement. So what does this mean? So this means any outreach teams. So some organizations may be interested in expanding their current service portfolio to contribute to outreach teams. And there are outreach teams, I believe, in all 3 counties. They're used in slightly different ways. In Multnomah County, we are expanding our current outreach and navigation team from 5 members to 25 members. So we'll be seeking organizations to participate in that expansion. In addition, there's emergency shelters. And so often this is connected right to outreach and navigation, navigating to emergency shelters and the services therein. There's also behavioral health and recovery outreach. This includes alcohol and drug recovery outreach, or what's called A&D outreach. So outreach to people living on the street or in shelters, or within many of our other service programs. Connecting people to treatment or community supports. And then there's safety on and off the streets. This is a broad category, but in essence, it's around providing survival services or survival gear. It includes providing any supplies needed during severe weather, which is both when we have snow or cold weather in the winter, and when in the summer when we're experiencing severe weather when there's temperatures that are really high. And there's also a number of other safety off the street services, and I'll phone a friend and ask Abby if she can expand a bit about how Clackamas County approaches that.
Sure. I wouldn't say that we have a nice comprehensive approach just yet. Clackamas County is a little behind on our building of our street outreach coordination. But yeah, safety off the streets, I think of it as harm reduction for those living outside, because not everyone chooses to go to a shelter. A lot of folks have a lot of trauma in shelter. And so we want to recognize that some folks really do want to continue living outside until they have an appropriate housing option. And so that's a recognition in this category that the goal of outreach isn't always to move someone into a shelter. It's also to keep folks where they're safest, where they know that they're safest, until they can, either build enough relationship or trust, or until they have a housing option that meets their needs.
Thanks, Abby. And I earlier covered sort of these basic supply needs, survival gear, hygiene services. And I just want to note here, your organization need not have already been providing these services. So you just really need to have an interest and the infrastructure to add this to your portfolio of services. Next slide. So the next service component we'll cover is shelter and transitional housing. And I'll ask Abby, Jess, or Ty to just really round out anything I miss here. So this is presented like a continuum, but you don't need to provide all of these services, just an element. We're talking about congregate and non-congregate settings. So with the COVID-19 pandemic, some of our shelter services and our transitional housing services, the way that they are delivered has really changed from a congregate model. And what congregate means is sites that have more than one person in a sleeping location. So there are some shelters that are sort of like a large open space with a number of cots. So that would be considered a congregate setting. Some transitional housing programs may have bunk beds in a room and, sort of an old school model, like 4 people to a room, something like this. So for people that are medically vulnerable, those settings are no longer ideal. And we're moving to
and Crystal, your audio just cut out for me. And I think you were just covering the non-congregate definition. So maybe Abby or Jess, if you wanted to pick up right where Crystal was just doing a great job.
I can do that. And we can maybe test Crystal's audio in between and see if it picks up again. Yeah, so I think of congregate and non-congregate as a little bit of a continuum, right? From big rooms with a lot of people all the way to individual households and an individual room one room per household would be the full non-congregate. And many folks moved to a hotel motel model during the pandemic to make sure our medically vulnerable folks had the kind of safety to mitigate chances of catching COVID. Alternative shelters, this is sort of a other category. So I think there are certain types of shelter, like sanctioned camping might be something that you've heard of as a term that could fall under the alternative shelter category. So things like that you haven't traditionally thought as shelters could be an option. I'll maybe leave that one for somebody else to add to. Is your sound working again, Crystal?
test.
Yes, you're back.
Okay. My cat is now trying to get into this, have his cameo. Okay, I just wanted to add in terms of alternative shelter in Multnomah County, this has become an important part of our SHS expansion. So we are undertaking a number of alternative shelter programs, and this is both across our county and in the city of Portland. So we have, I think, 6 sites planned for the city of Portland. Okay, sorry. I'm sorry, but not now. So we have 6 alternative shelter sites planned with the city, and we have an additional 2 sites currently planned in the county. And part of our goal with that expansion of alternative shelters is to ensure geographic equity. So those shelter programs vary based on sort of what the provider wants to do. So we have some population-specific shelters. For example, we have a sanctioned camping alternative shelter program for veterans. So some of it is up to the proposal that the provider submits to us when we open up a request for proposals to deliver alternative shelter. Facility-based programs, this is related to mostly transitional housing or treatment programs. And so this is typically limited by time. So, 1 month to 1 year, focused on a specific program of services, right? So recovery housing for people who are in a drug and alcohol program, or behavioral health housing.
Just had another quick freeze there. Yeah, so facility-based programs, like she mentioned, in Washington County, those might be classified under our PSH, which is, so these are programs where we have converted motels that are now turned into sort of these like transitional type of models where folks can stay there for a short period of time as they transition into another alternative housing option. We could check if Crystal's back, but it maybe I think we have one more component, one more under this section, which is the time limited and emergency housing. Would anyone like to speak to that?
Do you want to try, Crystal?
Oh, yeah,
Okay.
okay.
I apologize to everyone in this meeting, and my colleagues will just step in as this continues to happen. Not sure. This is the digital world, I guess. So time limited or emergency housing. This is sometimes called rapid rehousing, and there's a time limit. Typically it's 2 years. So this would be under this component. A lot of times there's a program associated with it, either at the county level. We also contract services for that, and they typically have some type of funding for housing to pay for the rapid rehousing, and then funding for services. All right, this is our third service category or component, connections to stable housing. So this is in particular a component you want to look more closely at in the RFPQ, because there's a number of things in there that aren't covered here. And just want to call out that this is a component that affordable housing developers are also going to want to look at, and they can apply to this one. So earlier when we talked about affordable housing owners and operators, we want to include developers here, and people from the housing world will know that each of those definitions is actually quite different. But we want to make a call out to all 3 categories of affordable housing. So diversion happens in a couple of different ways, but in essence, this is emergency rent assistance. So typically it's a person or family that currently is in a housing situation or a permanent housing situation, and just needs some time limited supports around maintaining that situation. So sometimes it comes in the form of like 1 month of rent, and other times it's a longer period with some case management support.
I'll just hop in because we run diversion quite differently in Clackamas County. So our diversion programs have pretty limited funding. And so they're really meant to be problem-solving conversations that sometimes have no funding attached to them, and often are about finding alternative, immediate, safe sleeping options in the meantime while trying to solve for a more permanent or long-term housing solution. So in a perfect world, we would have diversion that's looks like a problem-solving conversation with follow-up for the next step, constantly trying to solve for where folks might sleep tonight until they can get connected to or on a path to permanent housing or more stable housing.
Thanks, Abby. And like a lot of times this comes up in people who are fleeing domestic or sexual violence. So that is really how that service works within that population specific. It's meeting that need for that specific population. And the 3 counties, this is the first time we've done this tri-county RFPQ, and we're aligning on terms, and the context for our services in each county is a little bit different. I want to acknowledge that. So thank you for bringing that up, Abby. So we talked about rapid rehousing before. And so I think it's important to note that, it can look a couple different ways, and it's here in this component too. So I may have made a mistake. I want to acknowledge that. And we'll need to go back and look at the RFPQ categories, and I can send an update in a follow-up email because I'm seeing it here in this other component. So I covered rapid rehousing and eviction prevention. And eviction prevention is in Multnomah County a part of our diversion services. So again, it's time-limited funds to help people maintain their housing. It can also be legal services to help address any legal questions related to the eviction. And then I see a question in the chat, need clarification on the role of affordable housing owners and what we could apply for. Jess, is that something you could help clarify?
Oh, I'm off mute. I'm so sorry. Yes, I'd be happy to. Yeah, actually, I think it's this specific service component that is most geared towards affordable housing owners and operators. When you think of yourselves as an owner or operator of permanent supportive housing programs, because in addition to the service provision, which we've been spending lots of time here today describing the various kinds of services, and many of them are here on this slide, like housing retention services a case manager might provide on site in one of your buildings. There are also on-site services that you as a building owner might need to provide in order to support the provision of permanent supportive housing. And I think of one of the boxes here that says resident services and other building operations, like property management staff over 24/7, if that's sometimes a need for a permanent supportive housing building, or additional maintenance costs that sometimes happen with more frequent turnover, just serving higher needs households. So we recognize in order to partner with the provision of the services that will be provided by maybe not the building owner, there are services that are also provided by a building owner when providing permanent supportive housing. And this might be different in each county, as Crystal was describing for previous service component. But in, for example, Washington County will also be working with building owners to pair the long-term rent assistance voucher as part of that service provision contract. Yes, so when thinking of PSH, if you as a building owner are interested in providing PSH, these are some of the things that will be made possible by way of enrolling as or applying and becoming an eligible service provider through this RFPQ.
And someone correct me if I'm wrong, but my understanding is also that if somebody has an affordable housing site and would be interested in having services connected to that site, even if they didn't provide the services themselves, that they could apply to essentially be a site. And then in the next phase, after everyone's qualified, when we do a little of what I like to call matchy-matchy, we can try to match up programs and look at qualified sites and match up services as funding is available and prioritized.
Thanks, Jess and Abby, for covering that. And again, if any owners or developers or operators are here on this call today, please feel free to ask questions and also to visit the question portal on the Washington County procurement site. It's a running list of all the questions that have been asked since the RFPQ opened on December 1st. So please reach out with questions and any technical questions from the housing world. So landlord recruitment and retention, this is another regional component that we'll be unrolling, and it's a part of our regional long-term rent assistance. So our regional long-term rent assistance program operates kind of like the Section 8 program that that HUD manages. So it's a long-term housing voucher. And each county is estimating that they will issue about 500 long-term housing vouchers this year. So that's our goal. It's 1,500 total. And part of that program is an element around landlord recruitment and retention. So we'll be starting to do heavy outreach in the coming months to bring in new landlords to our system, which is really required to expand our capacity and ability to place those long-term rent assistance vouchers. And finally, housing retention. So retention can look a couple of different ways, but in essence, it's a case management support that can be either offered on site as part of a resident services menu of services, or through case management, like mobile case management, where people go where case managers go to the client in their apartment, or they talk over the phone and support them to maintain their housing and address any needs that might be coming up that could affect their ability to retain their housing.
I just want to clarify that I'm pretty sure Clackamas County's goal is 250 Arlo placements. I don't want to publicly commit to 500, but we're gonna do real good work with those placements.
Thanks for the correction. Thank you. I believe this is our last service component, wraparound supports. So these are services like peer support services, which is a high priority for expansion in Multnomah County. Benefit, navigation, and legal services. So benefits relate to any medical or social security or veterans benefits that the client is eligible to apply for. So assistance around that. Navigation, so moving from, let's say somebody's awarded a housing voucher and now they need assistance around placing that. So that's considered navigation. Navigation can also include helping to prepare the documents needed for move-in. And I'll ask Ty and Abby if there's additional elements to your navigation programs. And finally, legal services has to do with addressing any legal questions, including like if a client owes arrears, if they are justice involved, if they've experienced housing discrimination. Education, training, and employment. So this relates to client services around these three categories. And health services. So this includes outreach services, so medical services that are mobile or go to shelter or even to affordable housing sites, drug and alcohol services, just the gamut, right? The menu of those types of services. It can include needle exchange. It's quite broad. Anything else to add here? I want to encourage folks to look at the RFPQ and the descriptions under the service components. Again, starting on page 12 of the RFPQ, there's many more examples there. If you have questions about these components, you'll want to post those questions in that question portal on the Washington County site. I'm seeing a question right now. Oh, sorry, go ahead. Does our subcontractor for health services for PSH residents need to apply?
I'll offer to help answer, but I don't know that I have the final answer. In Washington County, we have the capacity to allow subcontracting within our contract. So I think the answer is no for us anyway, but that might be something worth specifically following up with if you're working in a specific county.
We don't have our procurement person here on this call from Clackamas County, but I understood that anyone who wanted SHS funding would want to apply directly. So my best answer to that question would be, I would err on the side of caution and apply, especially if this might be an agency that might want to offer services and expand as an agency and offer across counties. Because they might not have an existing relationship with a Clackamas County provider to subcontract, but they could be their own provider in Clackamas County, and then we could do, again, the matchy and make sure that programs have the wraparound services they need. So I still would always strongly encourage them to apply independently as well.
Yeah, echoing Abby, we encourage subcontractors to apply, and in many instances in Multnomah County, our subcontractors are in the subcontracting arrangement because they did not initially apply to an RFPQ to qualify for services. Of course, that's not across the board. And in Multnomah County, we do allow 4 subcontractors. So that is a part of our contracting ability in Multnomah County. Okay, so our next slide.
And I can speak to this a little bit. I think it's one of the features, maybe lesser known features of the RFPQ and qualified organizations is that all of the SHS qualified vendors are eligible to be providers of peer-to-peer technical assistance. And that is a feature that can come in a variety of different things, which could include peer training, other peer organizations, and skills that you might have to improve and better other organizations, providing technical assistance to other organizations. And then cohort support. This is an interesting one because currently we don't have cohorts, but I think it's one of those things visioning in the future of establishing cohorts. So we may need one of our SHS qualified providers to provide some of that support. So that is going to be a feature that we'll be rolling out here in the future. Educational materials, and this can be a variety of things. It may be culturally specific educational materials. It may be translated educational materials. Many things that need to be developed here in the future. We would love to rely on our SHS providers to create those and develop them for our regions. Operational and administrative capacity building support. So I saw a question earlier relating to this point right here, and so I know that capacity building is a strong and important piece of how we develop organizations in our region and in each region, and so that might look differently for each region. So, Washington County, we're rolling out some strategies around culturally specific capacity building currently, but that also could look very different in different regions. So I would say that right now we don't have an official message across the 3 counties, but it's something that I think as we continue to grow and expand our services, we're going to be looking at those opportunities. You know, some of it's based off of the surveys and kind of communication with each organization and some of the needs that we might be hearing on the local area. And some of it is, you know, based off of priorities that we see opportunities to expand. So does anybody else want to speak to that piece?
I was just going to support you in that, Ty. I thought you weren't going to quite get to the point I was going to make, and then you got to it. So I just want to elevate the idea that we want to be flexible with the kind of support that agencies might need to build capacity, and know that not every agency is the same, and we don't always grow at the same rate. And so we want to be flexible in the things that we're able to offer, and have an open communication to learn about what agencies are needing to build their capacity. So we want really strong organizations that have the ability to do the financial piece and the invoicing piece, and that's not a holdup. In often what I find, agencies do great services, but some of their technical stuff, they just haven't been trained on. They just don't know how to set it up. So a lot of our capacity building conversations have been about that, like, background knowledge piece that it takes to build a nonprofit when you start a nonprofit, because you want to make sure the people have what they need. So sort of that background piece.
And I'll just jump here and add one final thought. But I want to just say that I thought Ty and Abby both did a great job. And I think Ty really captured sort of how this component is going to be used over the next 5 years. So there's just we anticipate there will be a number of opportunities to lean on the technical expertise of organizations in our area. So I just wanted to add that this is really also in response to something we've heard from many of our organizations in Multnomah County, which is we ask our local providers to give guidance to the development of services or trainings. But we ask for information and we consult with them, but we don't necessarily pay them for that consultation. So this is a way that we actually can pay people to participate in that process. So just adding that there.
Excellent. So that kind of wraps up our presentation on the service components. Please feel free to continue to populate our chat or the question and answer section with any questions that you have. I had some great questions today. And I encourage you, if you do have any questions, we are going to have some time here at the end. But I'd like to turn over to Susie Folger, who is our purchasing supervisor at Washington County. And I will stop sharing screen and have her take over the reins of our presentation for this portion.
Thank you, Ty. Okay, so make sure I share the right screen. Hopefully everyone is seeing an OpenGov screen. Yes, thank you. Okay, so there are several ways to get to the portal, which is good and can also be confusing, unfortunately. So using the link that we put in the chat, it will take you right here. If you go to the Washington County website, you can find it either by looking for procurement, which is under support services, and going to our portal there. Procurement portal, or the easier way is just in the search bar. If you type in procurement portal, it will take you directly to a link that again takes you to the OpenGov procurement. Get this out of my way. There we go. So once you're at the portal, you would scroll until you found the Tri-County Supportive Housing Services. Choosing that allows you to go through and look at this, all of the specifications and those types of things. So you can click here, look at the introduction, scrolling down, there's my contact information, also the timeline, including these pre-proposal conferences, the technical assistance information, submittal due date, all of those things are here. Section 3 really just points you to the exhibits because all of the project details and the scope of work and instructions have been included in the Tri-County Supportive Housing Services RFPQ. So all of your main information is here in Exhibit A. Exhibits B, C, and D are simply copies, samples of the contracts that successful responders will be asked to sign. So we do that. So if you want to run them by your legal, you can do that. And if they have any questions or issues, we can get those started now instead of down the line when it's time to contract, you know, that can cause delays. So we put those there. They do not need to be completed or turned in. They're simply for your reference. The last thing under exhibits is the services component form. That does need to be completed. One form per each component that you are applying for. So you would open that. No, I don't want to follow the project under this name. I'm already following it under my other name. So you would download that document and again, complete it, save one for each of the components that you are responding to. And then the vendor submission field, this tells you everything that you'll need to do in order to apply. Several of them are just yes or no questions that you'll have to respond to. And then there are a couple uploads. When you are ready to upload, you would go to draft response. Oh, and it wants me to update my, but it's not going to make me, so that's good. Oh, yes, it is going to make me. So there we go. So I bypassed. I said to bypass it. So again, you can go down, choose yes or no, depending on the question. And then this is the bigger part. So you will upload in this section your form and the answers to questions from these sections in the RFPQ document. You only have to answer these questions once. So if you have, let's say, 3 components that you are applying for, you would do a Word document and respond to these questions. And then you would do a component form for each of those 3 components. So you would upload a total of 4 documents. If you are just doing one component, it's going to be 2 documents. Your responses to these questions, and then the component form. So depending on how many components, that will depend on how many things that you upload to this file. And this is a drag and drop, or as you just saw, you can click on it and pull it from a file. If you have some information that you feel is confidential, you can upload it here. I don't think there is any, but if you feel that it's confidential, you can upload it here. If when you are reading the sample contracts provided, you feel that there are things that you want to talk about or that you want to bring to our attention, you can upload those, just a simple Word document saying, section 3.4 of the terms and conditions says this. And whatever objection or change you might want, you can upload that there. And then this is just asking you how you found out about the solicitation. Once you're done, I'm not done, so it won't let me, but you would just click on continue, and then it will let you finalize the document. Now you can do this anytime, and if at a later date, as long as it is prior to January 31st at 4 o'clock, you can pull it back and make changes. So if you have uploaded your document and your component forms and you decide you need to make a change to the document, you can open it back up, remove that document, replace it with another document, and then resubmit. So it's not like once you put it in there, you can't touch it again. So I always recommend that you do this piece as soon as you can, because if you wait until January 31st at 2 o'clock and you have a problem with your internet or something, and you're not able to upload it in time, we can't accept it, which we don't want, and obviously you don't want. So we really encourage you to do it early. And again, if you put it in and you need to make a change later, you can always pull it back, make that change, and resubmit. I see that there were some things in chat. I don't know if that's questions for me. You cannot get into the portal. I'm not sure why you wouldn't be able to get into the portal, but perhaps you can contact me offline and we can walk through it. If you are, so I'll come over here. So this is what it looks like when I log in with my name. Before instead of going to one of those links, I just went to OpenGov and logged in. If I have to click on find projects, and then I have to choose Washington County before I get here. So it's possible maybe that you hadn't got to this point. Or if you are having problems here and you're not able to choose the Tri-County Supportive Housing, you can click on the little bubble over here. They are very good at getting back to you and helping you with any issues that you might have, again, accessing something here. I think that covers everything unless someone has questions. Again, my information is on here. It is on the chat now as well. So feel free to give me a call or contact me if you have questions. And real quick, I will also show you, sorry, I didn't do this earlier. If you want to download all of the documents, you can click on this tab. And it's just an easier way to download. You can click on the things you want to download and then download them all at one time instead of trying to do it one at a time. If we have issued addendas or notices, which there is one addendum, and an addendum changes something in the document, so you're going to want to be sure to check that out. And notices are more just informational. They might not necessarily change something, but in this case, we posted the technical writing assistance form to help you get signed up for technical writing assistance. And then we also posted the last two pre-proposal, or the recordings from the last two pre-proposal conferences. We will post the recording from this pre-proposal conference, hopefully by tomorrow morning, and also the slide deck if somebody needs that. So all of those things will be here. We talked earlier about questions and answers. You can see here there's been several questions. So the questions and answers from everybody are posted here, so you can see what other people have asked and see those answers. And then you can see here we have one question that's outstanding. We haven't provided an answer for that yet, and it's super easy. You just click on the ask questions. And then I can put a subject in there if I want to, and then my question, and then I could submit the question. And I think that's everything.
Thank you so much, Susie. There was one question that just popped up that's asked if the service component form is a fillable form.
I believe it is, yes. Did I put it? I think it's a Word document actually. So yes, it is a Word document. Sorry, it came up on my other screen. Let me pull it over here. So yes, you can just click. And again, you only get one component per form. So even though this will let you click multiple, please do not. Please choose the component that you're responding to. And then you would complete each area. And the question was asked if you could use a different document and no, we would want you to complete this form and return this form, please. So hopefully that answered the question. Anything else? There's a word I don't know. I haven't tried to translate it and I don't have Google Docs, so that's not a question I can answer. Perhaps someone from Multnomah County who works with Google Docs knows the answer to that.
Yeah, excuse me. When you're in the Google document and you select Save As, you actually have a number of options. So you can save it as a docx, you can save it as a PDF, etc. So once you're complete with the Google document, then you'll save as docx and can upload it that way. Or PDF if you'd like.
Or PDF.
Sorry, PDF is actually like standard practice because nobody can change what's in the document. So I would recommend PDF. But if you save it, yeah, if you save it as PDF and like you email it to yourself as a backup, then you'll want to make sure you can go back to the Google document or you can't make any changes. Pro tip.
Good to know. Thanks, Crystal. All right. Anything else? Small, don't have a word license. Oh, that's a good point.
Yeah, so you can just download it, save as PDF. You don't need to save your documents in Word. Or rather, sorry, you don't need to submit your documents as a Word document.
Correct. It can be in any, as long as it's a readable format, as long as we can open it and read it. All right, I will hand it back over to you, Ty.
All right. Great. Thank you so much, Susie, for your presentation. And yeah, we will follow up with you, Sandra, if there is any, document access needs. Let's do some follow up on that for specific needs from organizations. So with that, I'm going to go ahead and share screen again and go over the components of your application in just a little bit more detail. And then we're going to talk a little bit about scoring and then and timeline, and then we'll move on to open the floor up for more questions if you'd like to raise your hands for those at the very end, and then we'll be wrapping up our session. So the application components, do folks see my screen right now with the application components? Okay, yes. Okay, great. Okay, so great. So each of these components is a two-page section. The first is the organization mission and capacity. Here you're going to be describing your mission and services, organizational capacity. This describes your just overall administrative and operational capacity, record keeping, etc. Data and evaluation is also in this section. This is where you might, talk about any data and analysis capacity you might have, any data contributions around Black, Indigenous, Latino, Asian, Pacific Islander, immigrant refugees, and underserved populations. And then staffing and retention is also in this section. Next section is also 2 pages, is the equity and inclusion section. This is where you'll describe your service population, your experience working with people experiencing or at risk of homelessness, as well as any of the SHS population served. Racial equity is described here, where you'll be talking about your guiding principles as organizations and how you address racial equity, and also describe your experiencing delivering anti-racist services as defined by the SHS services approaches in section 4A5.5. Also culturally responsive and culturally specific services, and your demonstration here is of your organization's experience and expertise, being effective in your effectiveness in culturally responsive services or culturally specific services. And this is also has definitions for both of those, culturally responsive and culturally specific in that section for A.5. So. And then the next section is the service delivery. This is another 2-page section. This is where you'll describe your organization's approaches to service delivery and how it aligns with the SHS service delivery approaches. Also access. Describe your organization's experience providing services to people with multiple barriers to access. And this section, you're also gives you a place to, describe any partnerships that you might have, kind of your intersection in alignment with other organizations or coordination with other agencies, and sort of the strengths that you might have in these partnerships. Expanding either to more diverse communities or ways in which you provide additional services, maybe subcontracted with or partnerships with other orgs. And then service components, we did spend a little time on this already. This is a 2-page per component. It's important to highlight that, we'd like to see a separate document per application here. This is where you're describing the component areas, which we did describe in great detail earlier. The blank forms are available and for download. This is where you will be describing the counties that you might be serving in, the service population, geographic areas, and your approach. And the important piece about this is your organization may have some aspirational designs that you want to do in the future. These do not have to be existing programs. So that's important to note. We want to see innovation here as well. In this section, we want your ideas and how you might demonstrate them, but we don't need to see a full proposal with funding and budgets and all of those things. That actually is going to happen in the allocation stage, where you will have a more of a chance to describe as a supplier how you might provide these services in greater detail as a program plan, as well as a budget. So this is more of a broader and more a general thing with each of these component descriptions. So each one dedicate 2 pages to. It's not enough to design a whole program in 2 pages. So this is more of a summary. All right. Great. And then next I wanted to talk about the evaluation criteria. So here is where each of these 4 sections will encompass 25% of your score. Organizational mission and capacity is 25% of your score. Equity and inclusion is 25% of your score, and service delivery is 25% of your score. Service components are also 25% of your score, but there's a slight caveat there in that many organizations may be applying for several service component areas. So we are scoring each of those service components independently, and your highest score will be added to your total score. So if your organization must achieve a 70 points or 70% to qualify officially as an organization. And so the service component section really is that scoring yourself over the top and jumping over that 70%. So sometimes we get questions of, doesn't that mean we might have a score higher than 100 because each of the service components, if you have 5 or 4 applications, might put us over the top. Well, actually, we're just going to pick your highest one and add that to your total score. So in this review process, it's intended that the organizations demonstrate that they're well suited to provide these services. We're judging these responses and intending to review them with examples of illustrating your organization's service approaches and how you implement these ideas. And so let's see. Am I missing anything else on the evaluation criteria? I'm just gonna check with my colleagues at the other counties. Okay, give it a thumbs up. Okay, great. So let me move on to the RFPQ timeline. We are now in January, so we'll jump ahead in the timeline a little bit, but we announced this in December 1st. December 7th and 8th were the first RPQ pre-proposal conferences, so they all received the exact same presentation. This is the third of that. January 21st is the deadline to submit any questions to the Procure Now website, and that's when we'll close the kind of question and answer time period, and we must respond to those questions by January 26th. So we did see one question still open there, and we have until January 26th to respond to that. And then, we plan to, of course, respond to questions in a timely manner. So please encourage folks if you do have questions, and they might be helpful for others to see those questions and also the responses to those questions. So those will all be on our Procure Now website and the question and answer section. The submission deadline is January 31st. Is 18 days away, 19 days away. Oops. And then February 1st through the February 28th is when the proposals will be evaluating and going through the review process. And then March 7th is when qualified providers will be listed and posted, and sort of the public announcement will be made of the qualified organization. All right. And on March 7th is sort of when we, move to the next phase, which is the allocation phase. So all approved providers will be eligible for contracts. Great, now this is your chance now. If you have not had a chance to get your question answered, want to open up the floor to folks to ask questions. You can go ahead and raise your hand at this point, or if there's any questions that maybe we didn't address in the chat area, we are happy to do that now. All right, there's one question from Jennifer Knapp. When do you anticipate funding to be available for qualified organizations? I think that's going to be different for each county, when projects become available. It's kind of on a rolling basis. My experience in Washington County is that every several months we're sort of rolling out projects on our procurement site and looking for qualified service providers. So that's, for our county, and it really depends our many component areas. So we may be rolling out some of our component areas sooner, addressing some of the more urgent needs of the community right away. And then some of the service area components might be rolling out in later dates. So I think that's, goes back to kind of hearing out what Abby, Jess, and Josh said earlier about some of the county priorities that are more urgent, as well as looking ahead to the future of what might be coming down the pike. And again, to encourage everybody to apply and get qualified, you'll be the first to be notified as soon as those opportunities come available for each of your counties by being a qualified service provider.
Just echoing what Ty said, it's going to be very similar in Multnomah County. We haven't had a qualified vendor pool before that can receive all of our project notices. So just reminding people that are not familiar with it, we currently send out project notices specifically related to population. So this will be the first time we can share all of our project notices that we issue from our office. We anticipate submitting some notices as early as the end of March. And as we go into our contracting season, which typically takes place between May and the end of June, we anticipate submitting a number of additional project notices.
Michael, actually before Michael, maybe Michael Sterner, I'll unmute you here in a second, but I'll have Liz, you have your hand raised, and then I'll have Michael there on deck maybe for the next question.
Liz, you are on mute.
And oh, that's okay, Liz. Great. Michael, maybe I'll invite you if you would like to go ahead and unmute yourself and ask a question.
Oh, sure, thanks. Yeah, it was just what I put in the text there, which was I just maybe when I look more closely at the application, this will make more sense, but I wasn't quite sure I understood the difference in the application question where we're writing about the service delivery, and in the fourth part where we're talking about service component. And I understand there's multiple service components, but I wasn't quite sure how those two things are different.
So I can speak to that. Okay, and everyone can hear me speak to that. So if you're looking at the RFPQ, service delivery is number 5 in section 4, and it starts on page 11. So this describes the service delivery approaches that we would like organizations to speak to. So this includes anti-racist services, culturally specific and responsive services, housing first, low barrier, and evidence-based practices. And those are described in that service delivery section of the RFPQ. And it starts on page 11 and it goes to page 12. Following number 5 is section 4B. Section 4B is the SHS scope of work. And that is where you'll read about the service components. Does that clear things up, Michael, or did you have a follow-up question?
No, that clears it up. Thank you very much.
That's a great question. Thank you for asking it. Thanks for raising it up.
Great. Well, we're almost at the hour, so did want to just give everybody a chance to ask questions, but want to thank everyone here for participating today and asking wonderful questions. Really some robust dialogue today. Do want to just invite my colleagues for if there's any last words, but thanking all of you for the partnerships between the Tri-Counties and being a part of this project. We're really looking forward to lots of great applications to review and read, and so much excitement coming from that. So I'd like to turn it over to anyone to just kind of close us out and wrap us up for the day.
I'll hop on and meet the glorious honor of wrapping us up. And I just want to echo what Ty just said. I think you did a great job, Ty, expressing really the excitement that 3 counties are experiencing. This is the first time we've done a Tri-County RFPQ for social services. So we're really breaking ground with this process. And our goal is really to screen people in to become a qualified vendor. And I believe the 3 counties are really committed to expanding capacity in our homeless service system across the region. There are going to be many opportunities coming up over the next 5 years, which is what you will qualify for through this RFPQ. But in addition to that, there are going to just be many opportunities to improve our homeless service system through the course of through the period of time that the Metro Supportive Housing Services measure will take place, and that's 10 years. So thank you everyone for coming. There is no project too small. So to our smaller organizations that might want to open and run a 4-bed shelter or develop their own, 2-person outreach team, we are excited to see your proposals and hear your ideas. We want to strongly encourage everyone on this at this meeting today to apply to the RFPQ. So thank you.